Next, we're going to learn about the endocrine organs of the head and neck. So we're going to start with the hypothalamus and pituitary. This is quite a difficult image to draw, so I'll just take it slowly. So draw the framework, a large hanging grape, which is the pituitary gland or hypophysis, with a small bud, the optic chiasm, in front of it. So I draw a right angle, and a little bud, and then here is the large circle. So the three regions are the hypothalamus, the infundibulum, and the pituitary gland. So the hypothalamus is located above the pituitary gland and below the thalamus, and it links the nervous system with the endocrine system in the pituitary, and it's involved in the actions of the limbic system. The pituitary gland lies in the sella turcica of the sphenoid bone below the hypothalamus, and the infundibulum connects the hypothalamus and the pituitary gland. So next, draw a line from the anterior part of the infundibulum down to approximately the middle of the inferior edge of the grape-shaped pituitary gland. This divides the anterior pituitary with the posterior pituitary. The anterior pituitary is known as the adenohypophysis, and the posterior pituitary is known as the neurohypophysis. You can label the median eminence, and this is an area superior to the infundibulum, and the hormones collect here before they're released into the portal system and then the general circulation. So the next step, we're going to draw some blue and red ovals in the infundibulum, the anterior pituitary, and the posterior pituitary. And these represent the three capillary plexuses. So in the top part of each, I do arteries. And that just to represent the capillary networks. And then with blue, just the venous part of the capillary plexus. And then we add a vein to join the upper plexus, which is the primary capillary plexus, to the lower one, which is in the anterior pituitary, and this is the portal hypophyseal vein. And then we draw two arrows exiting inferiorly to represent venous drainage, and they go to the cavernous sinus. And then on this side we do one arrow, and that represents the venous drainage, which is to the cavernous sinus. And then we draw a red line to represent the arteries, so the superior hypophyseal artery, supplies the infundibulum and the anterior pituitary gland, and the inferior hypophyseal artery supplies the posterior pituitary gland, and they are both branches of the internal carotid artery. So next we'll add in the nerves. So two green circles in the hypothalamus to represent the superior optic nuclei and the paraventricular nuclei, and they're part of the magnocellular neurosecretory system. Draw two green dots in each circle with two lines passing down the infundibulum to the posterior pituitary, as so. A bit neater than me if you like. And these represent the secretory neurons that release hormones near the capillary networks in the posterior pituitary gland, the hypothalamo-hypophyseal tract. And next we're going to draw two star shapes in green posterior to the two circles, and these represent the parvocellular neurosecretory cells, which are part of the paraventricular nucleus. So two little stars. They project to the median eminence and release hormones here So just a little line like that. And you draw a line from each nucleus to the primary capillary plexus. The neurosecretory nuclei release inhibiting and releasing hormones, which are then transported via the hypothalamic hypophyseal portal veins to the anterior pituitary to inhibit or stimulate hormone release. Next, we're going to add the hormones released by the hypothalamic nuclei. So I'll just mention them. So in the supraoptic nuclei, we have oxytocin. In the paraventricular nuclei, we have ADH. In the neurosecretory nuclei, we have GH, RH, TRH, GnRH, and PRH. And then coming out of here, in the posterior, we have the oxytocin and ADH. As you can see, these ones come straight back down here. And these hormones then come out this way. So we have FSH, LH, ACTH, TSH, GH, PRL, and endorphins. And that covers pretty much the hypophyseal pituitary system.